Hi guys, if you were wondering what happens to your nipples during a breast lift and reduction, stay tuned. I am Santina. I am a board certified physician assistant, and today I'm going to talk about what happens to your nipples if you're having a breast reduction, a breast lift. So we commonly get this question from patients about, oh my goodness, is my nipple going to be completely removed during surgery? Is it going to die? Am I still going to have sensation? Is it going to be perfused? So I'm here to debunk that for you today. So typically in a breast reduction, there are multiple different styles and multiple different things depending on the surgeon. There are two most common pedicles used in a breast reduction. So a pedicle simply just explains where that blood supply is coming from. So the first pedicle, which I would say is most common, is something called a superior medial pedicle. So all of that blood flow to the nipple is kind of coming from this central medial area here and kind of up top. So all along here. And then the second most common pedicle that a lot of people use are inferior pedicles. So those are going to kind of think of it like almost like a column, like an arched column. And so the blood supply is kind of coming from the bottom area of the breast. So the pedicle has to stay intact where to keep the nipple perfused. So that's where all the main blood supply is coming from, is the pedicle. So short answer to your question is no, we do not remove your nipples. We do not remove the entire thing unless it's previously discussed by your surgeon with you that they will be doing something called a free nipple graft, which I can definitely discuss in the next couple videos. Unless it's specifically discussed with your surgeon that they'll be doing a nipple graft, no, the nipple will not be removed. So we use that pedicle to keep the blood supply to the nipple, inferiorly or superior medial, and we leave that intact the entire time. So we do not alter the blood supply there. We keep that nipple. So we use a bit of a cookie cutter to make that nipple and areolar complex just a bit smaller for patients, just to kind of have it be symmetric to the breast itself. After we do that cookie cutter, we remove that top layer of skin, and then we kind of work our way around. It's very creative and artistic to work your way around. I remember the first time I saw a breast reduction and I saw the breast and then seeing it come back together, it was incredible. I was amazed. And so once we kind of take all the other areas around, remove the tissue, lift the tissue, we just keep the breast on top of that pedicle and move it more times up and just kind of stitch it in place to where it makes sense, not only to the breast position, nipple position on a normal breast that you would see. So I hope this helps answer any questions. Please do not be hesitant to get a breast lift or breast reduction. Your nipples are going to be great and they stay attached the entire time.